How many times have you needed to see a psychologist, get a pap smear, do an STI check, but you couldn't afford it or couldn't find a doctor available? Medicare has been a point of pride since it was first introduced in 1984.
That every Australian, from newborn babe to Prime Minister, can share in the fairest health insurance scheme Australia's ever had.
In Australia, they guarantee healthcare to all people.
We have better healthcare than we do.
But just how free, accessible, and universal is our national healthcare system?
You get it?
Yeah, I got it.
Yes. Let's look at bulk billing, which is when the government fully covers the cost of your GP appointment. A recent survey found that more than 1 in 5 GPs have recently changed their billing model from bulk billing to mixed billing or private billing, which in plain language means more and more people are having to pay out-of-pocket costs to see their GP. On top of that, wait times to see a doctor has jumped from an average of 2.5 days in 2019 to 4 days in 2022. But what's critical to know here is that what's an inconvenience for some is devastating for others. For example, if you're, say, a single mum living below the poverty line on JobSeeker, you can't find a bulk billing GP and you're forced to choose between seeing the doctor yourself or for your kids. Or say you're an elderly person on the age pension and you can't afford to see a GP for your regular care plus COVID antivirals. Or maybe you're a family living in rural Australia with the closest GP booked up for 2 weeks and the nearest one is hundreds of kilometres away. These aren't hypotheticals. These are real experiences happening to scores of people across the country.
Some of the stories from elderly people with no relatives still alive spoke about how difficult it was to advocate for themselves. One pensioner told me that he begged his GP to please bulk bill him because he couldn't afford medical care.
The GP crisis has flow-on effects, from fears it'll drive down vaccination rates to putting further pressure on our already stretched hospitals. GPs are the entry point into our health system. Without access, we're stuffed. So how on earth did we get here? Well, it's a combination of factors, but underpinning all of them is just one: a desperately underfunded healthcare system. Bulk billing GPs are saying that a low Medicare rebate, the amount the government gives doctors per appointment, is making it impossible to keep their doors open without charging patients out-of-pocket costs. That's because in 2013, the government froze the rebate.
This was Labor's GP tax. That was a temporary freeze.
The recent extension of the freeze under the last budget really reignited anger amongst particularly general practitioners and amongst patients.
The freeze is driving down bulk billing rates.
So while everything got more expensive, this payment stayed the same. Rebates are now rising gradually, but nowhere near enough to make up for 7 years of stagnation, let alone keep pace with the record inflation. So less doctors are bulk billing, but what about GP wait times? It's all related. Because the rebate is so low, being a GP is seen as a less appealing career path for prospective doctors, which is why we're seeing fewer and fewer graduates coming through the training pipeline, resulting in a shortage. At the same time, people are relying more on their GP for care instead of underfunded, anyone spot a common theme, overstretched hospitals, adding to GP demand and stretching out those wait times even more. The GP crisis hasn't come from nowhere. It's a culmination of decades of erosion of public healthcare. And between 2020 and 2021, 500,000 people reported missing a specialist treatment due to cost. Dental, mental, and eye care aren't fully covered by Medicare, and it's simply out of reach for millions who can't afford them. People on student visas and newly arrived migrants are locked out of Medicare, forced to take out expensive health insurance if they can afford it, and people in remote communities bear the brunt of health disparities without clinics in reach. The GP crisis isn't a discrete problem. It's a bellwether, an alarm bell signalling a public healthcare system in trouble. The good news is the new Labor government has committed to launching a strengthening Medicare task force this year and have committed some funding to the solutions that come out of it. But we need to hold them to account for publicly addressing the problems in general practice, and that means more funding. And we also need to look across the board at public health, at hospital funding, nurse wages, dental and mental health, at social inequalities like poverty that create ill health and demand better. We may not be America yet, but the GP crisis shows we can no longer boast a truly universal healthcare system here in Australia. Everyone deserves healthcare when they're sick, so let's stay vigilant, get angry, and fight until every one of us can have that assurance. So if you didn't quite understand that Australia's healthcare system isn't as free as you might have thought it was, I hope you get it now.